If your entire flock looks sick and you are chasing chicken with a syringe, don't panic. This is how we treat an outbreak, bird by bird, to save the whole flock. Make sure you watch till the end. Welcome. Jambo guys, welcome back. First I have to thank the Almighty Lord for making us see another day. So I'll start by greeting all of us. Good morning, good afternoon, good evening, good night, because we just come from different regions, different countries. We have a difference in terms of time. There are others who are sleeping, others are awake, others are at their workplace. So we don't know where others are. So we have to appreciate, because this is another day for us. This is another day for, let's say for me, because this morning I've just received a phone call from one of my, not even my client, from one of the farmers, which is an heartbreaking news. Because to him, he just wake up today morning, around 5 of the chicken are dead. Yesterday, from what he has told me, yesterday he lost around 5, not even 5, around 10 of them. So today he has just called me, seeing if I'm around so I can visit the place. We go look the way chickens are doing. To my surprise, I just went. I've seen the cookers are not doing well. Some of them are huddling, weak, they're diarrheaing, whitish. So I had to come so that at least I can make a good intervention. So the subject for today, I'm going to talk about poultry, and specifically I'm going to talk about a certain disease that I've seen from the history of the farmer, that I've seen from the, not even the history of the farmer, I've taken the history of the farmer, and apart from that, about the clinical sign has made me focus to that topic. So the topic of today is about Pullorum. So for Pullorum, this is a disease that is caused by Salmonella species, specifically the Salmonella Pullorum. This disease can be transmitted horizontally or vertically. So when I talk about vertical transmission, so that means that this disease can be transmitted from the hen to the chick through the eggs. So that's what we call about the vertical transmission. So about horizontal transmission, so that means this disease still can be transmitted from one chicken to another. This is through contaminated feed, contaminated water. So that's it about transmission of this disease. Another thing about this disease, we have to know that it has some clinical signs. And one of the clinical signs of this, not even one, we can talk about the whole clinical signs, especially for the chicks and the bigger birds. So basically for the chicks, this clinical sign that manifests itself include, we have the whitish pasty on the vent region. So that means the back of the head has a pasty, a white pasty diarrhea. And apart from that, they are weak. Apart from being weak, they can huddle. So that means they can huddle. In Kiswahili we call that kujikunja or kujikunyata. So that means that they are not they're behaving as if they're feeling cold, but that's not coldness. So they behave in such a way. So but in reality they're not feeling cold. That is a bacterial infection that has gone extreme. So we have to tackle that. Another thing that you can look, it is loss of appetite, and mortality rate is very high. This is the white pasty diarrhea I'm talking about. Then weakness, huddling, and poor appetite. It is not feeding well. It is down. Then we have talked about high mortality. These are the dead carcasses, which especially here we can see the dead carcass. These are the carcasses. So I have to recommend the farmer to do a proper disposal of these carcasses. In adults, these chicken can act as carriers, so that means that the chicken will look healthy, but we have the bacteria inside the chicken, but it does not harm them or show any other sign. So this means that it will be very hard. As we can see, adults can be asymptomatic carriers. Sometimes stress or other infection can trigger signs like whitish pasty droppings. A vent with the dry whitish fecal matter might mean that the bird is shedding bacteria, as we can see here. Actually, the mortality rate is very high. Okay, that's it about that. For confirmation, for diagnosing this kind of disease, we can just take blood sample to the lab so that they can test for this disease. They can do culturing so that and at least we can get a tentative diagnosis that this is Pullorum. So that's it about Pullorum. So another thing about Pullorum, so it's about treatment. Treatment can be done through, the best drug for this is a very strong antibiotic, that is endofloxacillin. So we will use endofloxacillin in our treatment for today. So you will see how we will do. We will mix that in water and the entire thing. As you can see, this is the owner of the chicken and her children are here. So we are directing this chicken gently to a quiet and enclosed space. This make it easier to examine them and without stressing them. We have to take some other cuckoos from the bushes. The way you have seen, we are doing, actually I can pull this camera. You can see we are now progressing. We have to put all the cuckoos in an enclosure so that we can administer treatment to them. Here is chicken chasing moment, which is fun. You have sometimes to pass through mabati. As you have seen, the kid is just passing through the mabati. Then you chase the chicks to a corner, maybe you direct them there, then you catch one. Have we ever tried chasing a chicken? It is not always that easy. Like you can see, I'm trying to chase one of it here. Here is it. Look the way I'll just catch it, but before I catch it, it has to pass me through merry-go-round. But finally, here is it. I have it in my hand. Yeah, here it is. Now we are going to treat our birds as follow. We are going to use a broad spectrum antibiotic from the fluoroquinolone family, which is commonly used to treat bacterial infection in poultry, such as this Pullorum disease. So we will use the medicated water for 5 to 7 days, depending on the severity of the infection. No any other water should be used apart from this water that contains medicine. Then I have to stir well to mix well. So before I mix this drug, I had a clean container, accurate measuring syringe, fresh clean water, and our drug. Important notes include: do not use in laying hens producing egg for human consumption due to the residue risk. Observe withdrawal period, which is 7 to 14 days for meat, and ensure even distribution of medication, and always follow label instruction or your vet's advice. It's now treatment time. Obviously, we expect these birds to be aggressive, maybe disturbing us in this room, making noise, want to go out, but today you can now see the way others are sleeping, others are down, so we have to give them a drug. So all these bugs are showing signs of infection, possibly Pullorum. So we are going to direct dosing using syringe, which is quick, accurate, and ensure each one gets the right amount before we release them. So we have to hold the bird gentle but firmly, tilt the head slightly, insert the syringe at one side of the beak, not straight down the throat, to avoid choking, and release the liquid slowly. Once dosed, I'll let them go one by one. This helps me keep track and prevent double dosing. Make sure your syringe are clean, accurate, and that each bird swallows before release. Also sanitize your hands between handling if you suspect a contagious condition. So all birds treated, I will repeat this for the next few days and monitor the progress slowly. It's extra work but necessary to get them back to full health. As we proceed giving this chicken medication, I have to tell the farmer that in future he should buy chicks from Pullorum free hatcheries, and he should do regular testing of flock, especially for breeders, and maintain clean and stress-free environment. So that's all about Pullorum. So Pullorum can wipe all of your stock. So for the farmers, you have to be conscious enough, observe biosecurity, observe hygiene. So that's it for today. So make sure that you obtain chicks from a reputable source, certified hatcheries, so that you can get chicks that are free from Pullorum. Because as we have seen, the mortality rate of Pullorum is very high. So you have to be conscious enough. If you like this video, you can like, you can subscribe to Maxwell the Rural Vet and beyond. Thank you for today.